Three hormones play important roles in adjusting kidney function: and antidiuretic hormone, aldosterone, and atrial natriuretic peptide. ADH, or antidiuretic hormone, is produced by the hypothalamus and released by the posterior pituitary gland. Antidiuretic hormone increases permeability to water of the collecting ducts, resulting in more water moving from the filtrate to the blood. So it regulates the amount of water reabsorbed by the distal convoluted tubules and the collecting ducts. This increases blood volume and pressure and allows production of concentrated urine. Antidiuretic hormone is inhibited by caffeine and alcohol. As you recall from your textbook earlier, that dehydration, this inhibition of this antidiuretic hormone causes more frequent urination, which leads to dehydration, which leads to that hangover effect. Diabetes insipidus was discussed in, I believe, chapter 10, which is a disease that characterized by excretion of large amounts of dilute urine and results from a deficiency of antidiuretic hormone. The reduced water reabsorption causes reduced blood volume and reduced blood pressure. So this shows once decrease in concentration of water in the blood is detected by the hypothalamus which produces the antidiuretic hormone stores in the posterior pituitary gland. So the nerve cells in the hypothalamus produce the antidiuretic hormone, which traveled and stores in the pituitary posterior lobe of the pituitary gland. So once this decrease in concentration of water in the blood is detected, antidiuretic hormone is going to be released. Antidiuretic hormone is going to prompt an increase in the permeability to water of the distal convoluted tubules and the collecting ducts within the nephron. Thus, more water is going to move from the filtrate back into the bloodstream. This is going to increase the concentration of water in the blood, which causes an increase in blood volume, an increase in blood pressure, and a decrease in urine volume. Aldosterone is released by the adrenal cortex. That's that little structure, little organ on top of the kidney. It increases reabsorption of sodium by the distal convoluted tubules and collecting ducts, also resulting in more water following the sodium as it moves from the filtrate to the blood. Again, it's going to increase blood volume and blood pressure and also allows for the production of concentrated urine. As previously mentioned, sodium reabsorption is important because water is going to follow it. Aldosterone is released in response to blood pressure that is monitored by the Juxtaglomerular apparatus. The Juxtaglomerular apparatus is a group of cells which is at the junction of the distal convoluted tubule and the afferent arteriole that monitors the blood pressure. These cells release an enzyme called renin, which is going to convert angiotensinogen, which is produced produced by the liver, into angiotensin 1, which is going to be further converted to angiotensinogen 2, which is going to be the active form that stimulates the adrenal gland to release aldosterone. So it's going to be a cascading effect where renin is going to cause one conversion to another conversion to another conversion that's going to stimulate the adrenal gland to release aldosterone, which is going to cause sodium to be reabsorbed. This shows the location of the afferent incoming arteriole and the juxtaglomerular cells in that afferent arteriole secrete the renin in response to reduced volume of filtrate within the nephron, which is going to cause more sodium to be reabsorbed, thus more water. Atrial natriuretic peptide is released from the right atrium of the heart, and this is in response to the detection of increased blood volume and pressure. So it's going to decrease the reabsorption of water. Going to decrease the reabsorption of sodium and solute by the distal convoluted tubules and collecting ducts, resulting in more sodium and water remaining in the filtrate. So it's going to act to decrease blood volume and pressure, and it's going to produce large amounts of dilute urine. So if more sodium is going to be excreted and not reabsorbed, but more sodium excreted, again, then more water will follow the sodium, and which will lower the blood pressure and blood volume, but it's going to produce larger amounts of dilute urine. Atrial natriuretic peptide also acts to inhibit aldosterone and renin, which is going to have the opposite effect. Under the influence of atrial natriuretic peptide, decreased water and solute reabsorption for the kidneys, and large amounts of dilute urine are going to be produced. Kidneys have two homeostatic functions unrelated to the urinary system. As we previously studied, they release erythropoietin, which is the hormone that stimulates the production of red blood cells in the red bone marrow. The kidneys also transform vitamin D into its active form. Vitamin D, of course, we absorb from the sun. Vitamin D promotes the absorption and use of calcium and phosphorus by the body. Calcitrol is actually the active form, which promotes calcium and phosphorus reabsorption. Renal failure talks about decrease or complete cessation of glomerular filtration. It can either be acute, which is an abrupt cessation of kidney function, or it can be chronic, which means that it comes on over time. Acute causes can happen because of damage occurring to nephrons by severe inflammation. Certain drugs can lead to acute kidney failure, poisons, low blood volume due to severe bleeding, or even an obstruction by kidney stones. Chronic renal failure can occur over a period of months or years when the nephrons are destroyed. Consequences of renal failure include acidosis because of decrease in blood pH due to the inability to excrete hydrogen ions, anemia because of the hormone erythropoietin that can have low number of red blood cells, edema, fluid buildup because of water and salt retention, hypertension due to increased blood pressure caused by the failure of the renin and angiotensin system, and salt and water retention can result in the accumulation of nitrogen containing waste in the blood, affects the inability to remove toxins from the blood, and inability to regulate blood volume and blood pressure. Treatments for renal failure are hemodialysis or continuous ambulatory peritoneal dialysis. Hemodialysis uses artificial devices such as artificial kidney machines that cleanse the blood. The continuous ambulatory peritoneal dialysis basically uses the individual's own peritoneum as the dialysis membrane, or there's also kidney transplantations. This shows the continuous ambulatory peritoneal dialysis, wherein it's done in a patient's home. The dialyzing fluid is suspended from the container and the tubes inserted into the peritoneum. This acts to remove waste from the blood across the peritoneal membrane and into solution. Typically, the fluid is passed into the abdomen, left for a few hours, removed, and then replaced with new fluid. Continuous ambulatory peritoneal dialysis requires about 3 to 4 fluid changes per day. You can move, the individual can move around between the fluid changes, so generally is less disruptive than hemodialysis. Also talks about gentler, so it maintains more constant physical condition for the patient. It provides this continuous ambulatory peritoneal dialysis, wherein it's typically done at the individual's home, provides more opportunities, though, for bacteria to move down the tube into the abdomen, resulting in infection. It is less costly, though, than hemodialysis. Talks about most times the donor kidney is placed within the pelvis. The own individual's kidneys are not removed. The ureter and blood vessels of the donated kidney are attached to the recipients. The donor kidneys can be kept alive and healthy for approximately 48 to 72 hours. Kidneys were one of the first organs successfully transplanted. Identical twin, of course, would be the best choice. After that, a close relative or sibling would be the next choice. Approximately 90% of kidneys are donated by close relatives, or still alive within the, still living after 2 years. Approximately 75% of kidney transplants from unrelated donors are still living after 2 years. So there's about a 15% difference there from an unrelated versus a related individual in kidney transplants. Even after transplants, patients typically have to take 2 or more drugs for life to suppress the immune system and rejection of the kidney. Urination is the process by which the urinary bladder empties. It includes both voluntary and involuntary components. Just like in the digestive system, we have an internal and external sphincter. One's under involuntary control and one is voluntary control. We learned that as a child. The internal urethral sphincter is a smooth muscle. It's located at the junction of the bladder and the urethra that push urine into the urethra voluntarily. The external urethral sphincter is a skeleton muscle and it's voluntary. Neural connections to the external urethral sphincter are not fully developed until approximately 2 to 3 years of age, and of course we know this as potty training. And so this just shows the reflex that as the bladder fills with urine, stretch receptors in the wall send muscles to the lower part of the spinal cord. These impulses are going to travel back to the urinary bladder, cause a muscle to contract and the internal urethral sphincter to relax. Step 3, the impulses are going to travel to the brain where they initiate the desire to urinate. Step 4, if the time is appropriate, the brain permits voluntary relaxation of the external urethral sphincter and urine travels down the urethra and exits the body. Conditions associated with urination are incontinence or retention. Urinary incontinence is lack of voluntary control over urination. It's normal for infants and toddlers, and stress incontinence in women is more common due to childbirth. Urinary retention is the failure to expel urine from the bladder to a normal degree. May result from sensation to urinate, such as after general anesthesia, or contraction or obstruction of the urethra, such as an enlargement of the prostate gland. In women, the stress incontinence is more common, wherein small amounts of urine may escape during laughing, coughing, sneezing. Urinary tract infections, or UTIs, are caused by the presence of microorganisms in the organs of the urinary systems, and bacteria enter the urethra from the rectum or as sexually transmitted diseases. They're more common in women than men, and symptoms include fever, blood in the urine, painful or frequent urinations. Since they are bacteria, they can be treated with antibiotics, and it's important to treat the infection of the lower urinary tract to prevent them traveling upward to the kidneys. Pyelonephritis is the term used to describe a kidney infection due to bacteria that has migrated from the bladder into the ureters to the kidneys.